So, welcome to the first episode of my channel where we do a deep dive uh, with regards to the prevalent medical conditions in Indian society, and we talk about how to have a holistic approach towards preventive healthcare. And I have with me my friend, Dr. Chandan Reddy.
Hi. Yeah, so as Shiva told you about me, so I'm a medical graduate. I just recently did my MBBS, and he's called me to give a more detailed and in-depth description of various diseases. Okay. Today, what topic are we doing today?
So today we're actually going to talk about what is called syndrome X or metabolic syndrome.
Or metabolic syndrome or cardiometabolic syndrome. There's many names for it. So we'll get into the topic today, and as we go on further on, make more content. We'll delve deeper into other.
Yeah, we want
other
to dive
diseases.
into various topics and figure out what are the best ways with regards to interventions in exercise, interventions in nutrition, and raise awareness about what these conditions are, what kind of blood biomarkers are out there
Yeah.
for you guys to go out and have a look at so that we can empower the individual and give you good medical content and advice. So, with that said, we're talking about metabolic syndrome right off the bat. Chandan, what is metabolic syndrome?
So, metabolic syndrome is, it's not one specific disease or, one specific symptom. It's a multitude of symptoms, all right, a cluster of symptoms which mainly include insulin resistance. Starts off from insulin resistance and higher visceral body fat and hyperlipidemia and hypertension. Finally, ending off with atherosclerosis, which means, as like people already say, plaque in your blood vessels. Yeah.
Right. So it's plaque in the blood vessels.
Yeah.
Okay. Why should Indians be bothered about it, or why should we be worried about it?
See, the thing is, Indians are not used to the westernized diet. The westernized diet is mainly red meat, processed sugars. All right, we are not used to it. Our Indian diet was mainly high in fiber, a lot of fruits, a lot of whole grains. All right, chapati, rice, etc. And a lot of plant protein and obviously fish.
Right.
Yeah, we had a lot of fish in our diet. We were never used to this kind of diet, and so due to the rapid urbanization, right, and a lot of people moving in from villages into the city who are not, their genetics are not used to having the westernized diet, and because of that, and various lifestyle changes, right? Sedentary lifestyle, people are not working out a lot. That's one of the main things, and less sleep because there's a lot of hustle and work culture these days, right?
Yeah.
So the main thing is rapid urbanization, all right, and various genetic causes, because Indians are not the only race which are susceptible to diabetes and mainly metabolic syndrome. There's Indians obviously and Native Americans such as the Red Indians and the Latinos, Hispanics mainly.
Hispanics.
Yeah. Yeah, so that's about it. As far as Indians are concerned, yeah, diet and lifestyle is one of the main things, along with genetics.
So to sum it up, there is sort of a genetic predisposition in these ethnicities or in these cultures where people essentially are more prone to having insulin resistance, more prone to having or developing type 2 diabetes, and a lot of westernization has resulted in us adopting diets and a lifestyle that isn't really suited for our genes.
For our genes, yeah.
And that has resulted in a lot of, I would say, all of these problems getting proliferated.
Yeah.
Okay. Yes. Okay. You were saying something. Did you want?
Mostly even in pregnant women, there's pre-gestational diabetes and gestational diabetes. We'll dwell on it later on in another video. But even in them, our races are more susceptible to this.
The most susceptible to this because of the genetic predisposition.
Yeah.
So you were saying that metabolic syndrome is a combination of things like type 2 diabetes, insulin resistance, atherosclerosis
and higher body fat, higher visceral fat.
Okay, it's called hyperlipidemia if I'm not mistaken.
Hyperlipidemia is in your blood, and Visceral fat is, the obesity in the tissues,
Okay, the organ fat, right? So, could you actually tell us what is the cause, or what is it that actually causes this at a very base level? Because what I have heard, and I would like it to be confirmed by a doctor, is that it starts from insulin resistance.
Yeah.
So what is insulin resistance, and why does it kind of like, what exactly is insulin resistance, and how does it manifest in human beings?
Okay, so insulin resistance, basically, to simplify it, the cells in our body, even though there is glucose present, they won't utilize it because the cells, they're not sensitive to the insulin. All right, so if it's not sensitive, it's resistant, right? So what the function of insulin is, it helps in the cells to absorb the glucose and utilize it. Okay, and so if the cells have insulin resistance, once that happens, what happens is, now the blood sugar is increasing because the cells are not taking it in, right? The cells are not taking in the sugar, so the blood glucose increases. Now what the body will try to do is, because the glucose is increasing, it will try to release more insulin, so that the cells can try to uptake it, take it in more, take the glucose in more, because the blood glucose is increasing continuously.
Right. So I think it's what's actually happening is that the body is like, okay, there's no energy being given to the cells.
Yeah.
So increase.
Even though there is glucose present.
Even though there is glucose.
Yeah.
So it's telling the pancreas, I guess, to
the pancreas.
Increase insulin.
Yeah. So increase the insulin levels in our body. So what happens is, so the blood glucose is increasing, and to counteract that, the insulin increases. The insulin levels increase. Okay. And then again, because it's still not, because if you don't change your lifestyle, all right, if you don't change your habits, right, the blood sugars won't change. So again, the blood sugar keeps increasing, and over again, time it just goes to pre-diabetic stage, and then finally diabetes.
Okay. No. So it's insulin resistance is where the downfall actually, in a sense, actually starts
there.
Right. So how does this connect to, I would say, cholesterol, triglycerides, or hyperlipidemia, as you were essentially mentioning before?
Yeah.
Right? How does it actually lead to that?
Okay. So now there's increasing glucose, right? As I said, in the insulin resistant stage. So now what happens if there's more glucose in your blood? Your body will try to convert it and store it because you're not utilizing it. And so that increases to, that leads to increase in the body fat. And over time, the fat keeps increasing. And due to that, there is decrease in high density lipoproteins, HDL, as many people say. HDL is known as good cholesterol. What happens is, this good cholesterol, it takes the fats from the blood and stores it into your body fat. So it prevents your blood from having, high lipid. And what VLDL does is the opposite of HDL. It takes it from the body stores, the fat stores, and sends it into circulation.
Okay.
So the VLDL keeps increasing over time. And over, it clogs your arteries basically. That's what forms the atherosclerosis or the plaque in your heart.
So it's like a pipe in which water is flowing.
Exactly.
And there's some debris inside of the pipe.
Yeah.
So it ends up getting stuck.
Yeah.
Okay. And as a result, that leads to, I guess, heart problems.
Yeah. It starts off with high blood pressure because it's a narrow blood vessel, right? And it keeps getting narrower over time. The blood pressure keeps increasing. Yeah. So that leads to high BP too.
High BP too. Okay. So if I can just kind of backtrack and think about this. It's insulin resistance lead to cells not being able to utilize glucose.
Yeah.
That leads to your glucose levels rising. The glucose levels that rise end up being converted to fat.
Yeah.
That leads to more visceral body fat, and it might even lead to obesity.
Yeah.
And on top of that, because there is a lot of fat being accumulated, it leads to plaque being deposited.
Yeah.
And because of that, the heart starts to probably pump more.
Yeah.
That leads to high BP.
Yeah.
And because of the plaque, atherosclerosis. Did I get it correctly?
This time.
Absolutely. Right. So it leads to a heart attack as well.
Yeah.
Because the blood is not able to get enough oxygen.
Yeah. So the heart itself, it's also a muscle. It also needs oxygen and blood and nutrients, right? So if the arteries which supply the heart, which are called as the coronary arteries, if those are blocked, the heart doesn't get enough oxygen and nutrients. the heart becomes weaker, and that leads to heart attack.
That leads to a heart attack. Okay. So
or
this is like,
in many people might have heard it, MI or myocardial infarction, because the tissue in the muscle tissue slowly starts to deteriorate and die.
Okay.
Yeah.
Okay, so it's insulin resistance that seems to be the primary driver and mechanism behind all of these diseases.
Yeah.
So if this could be a tree of disease,
yeah,
you could call insulin resistance somewhere as the root.
Yeah.
Okay,
the seed even more specific.
The seed.
Yeah.
Okay. So we've also heard about like a type 2 diabetes, for example, or type 1 diabetes. We can go and get ourselves tested.
Yeah.
Right. But prevention, I guess, is better than cure.
Way better, yeah.
Way better, and early detection, they say, right, is better than detecting later on.
Yeah.
Because even if you've got diabetes, I mean, even for cancer, they say if you can screen and get it earlier done, it's better.
Yeah.
So it might be better even in terms of diabetes. So how do we test for something like insulin resistance? Are there any tests out there? Is there one test? How do you kind of like, get to know if you have it? Because I'm thinking, and correct me if I'm wrong, if you know that you're pre-diabetic, it's better to know you're pre-diabetic before you know that you're diabetic.
Yeah.
Right? Because if it's diabetic, it's too late.
It's too late.
The stories that I hear is somebody goes in because of an emergency surgery, and the doctor, they check what in a routine checkup, and they figure out that this person has uncontrollable blood sugars.
A person, because when you're getting into surgery, they do a simple surgical profile, a minor or a major, where you need to take a urine sample, the blood samples, and etc. Right? So you do your normal tests, blood grouping, simply for the surgeries. And then you do the blood sugar testing, and then you suddenly find out that this person has 250 or 300 mg per dl, the levels in the blood.
Sugar. Yeah. Okay, that is a huge amount.
And the person looks normal.
And the person looks completely normal. Right, but from the inside, that person is not
okay.
anything but normal. And this happened actually to a friend of mine as well. So he was in fact going for an interview. He got an interview and he got into a job. And you have like a normal test, right? Like a drug test that you have to do, and some health checkups that you have to go for the job. And it turned out that he had very low vitamin D.
Oh.
So I think one thing that we have as Indians is that we don't get ourselves tested. The blood biomarkers, we don't get ourselves tested properly. We try to be like an ostrich, I guess. Thinking that if we don't get ourselves tested, everything is going to be okay until, and then it becomes too late.
If you don't test it, you don't have it.
Yeah, if you don't test it, you don't have it. Yeah. And if I do a test and something happens, I'm going to blame the test.
Yeah.
It's like I'm going to blame the doctor.
Yeah.
And I'm going to be like, okay, this doctor is telling me something that I don't like. So I will go to some other doctor until I hear what the doctor tells.
Who will basically feed into my, image, what I'm thinking. Yeah.
Exactly. I see that in a lot of. I see that. Yeah. So I think that has to kind of change, and this is I guess an attempt that we're making, that this kind of thing has to change, because we have just one body and we have to take care of it in the best way that we possibly can. So, having put all of that into context, let me kind of again ask that very important question: is there any way to detect insulin resistance and do something about it?
Yeah. Well, there are a few tests. Obviously, there's a blood glucose. The standard. It is, how do you call it? Directly proportional to the insulin resistance. To if you have more blood glucose, more or less you do have insulin resistance. And the new test, HOMA-IR, right?
Okay, very interesting.
Yeah. And HbA1c, what that shows is the hemoglobin. It gets attached to glucose and forms glycosylated hemoglobin. That is HbA1c.
Right.
That is a test that most people, they're doing. And the cutoff, if it's more than 6.3 to 6.4, right, you get diabetes. Yeah, that is another test. And let's see, that's about it, I think.
That's
as far as the blood glucose, they're very simple tests. And there's continuous glucose monitoring.
Right, continuous glucose monitoring. So could you say something more about continuous glucose monitoring actually?
So what continuous glucose monitoring is, it's a patch, alright. What they do is, the patch has a needle and a filament. So they attach it either on the tricep or on the belly. And what that does is, they remove the needle and the filament stays in the tissue. So what this filament does is, it takes up the interstitial fluid. And what that means is, it's the fluid between the cells. Okay, it's not the blood glucose.
Okay, this is news to me. Okay, so continuous glucose monitors don't actually measure blood glucose. They measure
the interstitial fluid, the glucose in the interstitial fluid.
Okay. Very interesting.
Yeah. And so what happened, there's a chip in it and which continuously sends the glucose levels to an app in your mobile phone. So that the main reason is to not have emergencies of low blood glucose.
Okay. So I hear a lot of companies actually selling these continuous glucose monitors to people who are non-diabetic. And what do you say? Do you think it's just it's unnecessary?
For people who are non-diabetic, it's completely unnecessary. It's the most useless thing. It's a completely new, as you said, it's a money grab. That's one way to put it. For non-diabetic people, you do not need continuous glucose monitor. It was mainly developed for children and elderly people. As far as children go, because now we are talking about type 2, but as many people know, there's also type 1 diabetes. Alright, what that happens in that, the pancreas do not produce enough insulin in itself. So that's a genetic disease. That is seen in children more. So what happens is children, they're not used to getting needle pricks and those lancet pricks to continuously take the blood. They do not like it. So this way, this helps in measuring the glucose in a more painless way, as you can say.
Okay. So it was essentially developed for type 1 diabetes, where I think the monitoring has to be even more rigorous.
Yeah, vigilant and
rigorous compared to type 2 and for children. Which right now is being capitalized by a lot of companies you use this.
Yeah, as far as non-diabetic, even pre-diabetic people, it's not required.
It's not required.
Yeah.
So one of the things that they say is that it allows you to understand your blood sugar spikes, and it allows you to kind of like control for blood sugar spiking. But that leads me to a very question that I've always had, which is it's okay to have a blood sugar spike if you're a non-diabetic person, right? If I'm going to have sugar, probably it is going to not just sugar. If I'm going to have oats also, okay, at some point some increase in my blood sugar.
That's a normal human body response, alright. You have certain high glycemic foods, the ones you described, candies, chocolates, and even rice. All those are high glycemic foods. So the blood glucose levels increase rapidly when you eat foods like that.
Right.
And that's completely normal. What is abnormal is when you keep having it over time for a continuous period. Alright?
Right.
That is dangerous. Once in a while, obviously. It's a normal human, biological response. There's nothing, dangerous, once or twice, the blood glucose spike. It's quite normal,
Right. I think, and please correct me if I'm wrong, that a spike is fine, but I think you should return to a normal level again pretty quickly, because that means that your body is able to utilize the glucose.
So if you have, usually healthy diet, the blood glucose will definitely drop. Once, if there's a spike, it will come back to normal.
Okay. Is there any time as such, like timings or something? Like, for example, let us say, again, it depends upon the glycemic index. So if I have, let us say, only protein and fats, as far as I know, with very little carbohydrates, the blood glucose spike is not going to be very high.
Yeah.
But if I have a carb-rich meal, the blood glucose spike is going to be high.
So it becomes really high at around 1 hour, 1.5 hours, and then over 2 hours, it slowly starts, dropping back to normal.
Okay. So one thing that we can actually try instead of these fancy continuous glucose monitors is simply to do a test here once in a while, just to see if your blood glucose is able to come to a normal level.
Exactly.
After you've had a carb-rich meal. And that's another way of actually being like, it's cheaper. It's
way cheaper.
Way cheaper, right? Okay, a 2-week continuous glucose monitor patch costs I think 5,000.
5,000, it's 5,000.
5,000. And I think that's 5,000 is just normal. There are things that cost even more, like 7,500 or something. Right?
And that's just the patch, and then there's the app which has a subscription models too. Some of them.
Oh man. So I think maybe this would be better, and see if my blood glucose levels are essentially being normalized.
Yeah.
And if that is something that you do, you'll know that you are preventing any problematic. If that shows some abnormality, then you can kind of approach a doctor and be like, this is something that I have, right? And I think that's a good It's a good lesson that I've actually learned here, that you can actually do that in a much more efficient manner. And even if there's a blood glucose spike, if it comes back to normal, you are good to go. You're in a healthy state. I guess this coming back to normal is called homeostasis.
Yeah.
And that's about actually being healthy is all about. You're seeing to it that all of these fluctuations that are kind of happening in the body, because the body is always undergoing a huge amount of flux. That flux comes back to a level of balance, as they essentially call it.
That's one of the most, the first things they teach us in physiology when we are doing MBBS, right? The homeostasis, the concept of homeostasis. It's called, a dynamic equilibrium. Means there's always processes happening. But at a grand scale, there's always an equilibrium. Your body will always try to return back to normal. And when it doesn't, the problems occur then.
Okay, so it's the inability of the body to return back to balance is precisely what is the origin of disease. One could in a layman's way, or
better understanding the concept of diseases.
Understand the concept of diseases, the inability of a body. So that I think is a good way for me to actually ask the other question is, how do we see to it that these cells utilize the glucose in a better manner so that the spike that actually happens comes back to the homeostatic equilibrium, so that it can return back into the dynamic equilibrium that we were actually talking about? What are the lifestyle changes that we can adopt?
Obviously, the first thing you can start is, the most basic thing you can start is, more than anything, medical healthcare and most complex, simple stuff is, starts with diet. Okay, fiber-rich diet. All right.
Right.
And having as also lots of fruits and vegetables, and good amount of, how do we call it, non-processed sugars. Okay. And as far as diet goes, that's about it. Simple diet. You can have junk food once in a while. That shouldn't be your daily food.
Right. So from an Indian perspective, it's probably what our ancestors ate. Generally, what our ancestors ate. That rice was also fine.
It's actually quite good. Unpolished rice. That is one of the best.
Okay, unpolished rice. Okay. So that's what I've actually heard is that even though you're having white rice, it's fine even if you're having white rice.
It's completely fine. Our Indians have been having white rice since a long time.
Right.
Long time, centuries. So it's completely normal.
It's completely normal. We used to it also. Okay. And then what about exercising?
That's the thing. Once you get the diet part covered, there comes the exercise. Exercise, the thing with exercise is it's really important, because, as I said, insulin resistance is there and your cells are not able to, take in the blood glucose. So what exercise does is, you do exercise and your body is completely depleted of glucose. Right? And now your cells are glucose hungry. They do not have any glucose left in them whatsoever. Right. Now what they try to do is, now they want glucose and hence they become insulin sensitive.
Okay.
And so that way, the insulin can act on the cells and help it, absorb the glucose and utilize it. So research shows that, you can be insulin sensitive for up to 16 hours after workout. After post-exercise.
16 hours post-exercise, your ability to utilize glucose is kind of like elevated. Okay, that's very good to know, because if somebody is insulin resistant, let us say, and that person is of course that person has to do it, which is a good exercise and a good diet, then that person's already kind of on the prevention track and is on the kind of reversing. It is possible? It is just ask you to reverse insulin resistance?
Definitely. You can't reverse diabetes, but pre-diabetic stage and insulin resistance, it is very much possible. So with vigorous lifestyle changes in diet and etc.
Okay, and that can go and actually be very financially useful for the person also.
Definitely.
Because if that person ends up being pre-diabetic or diabetic, the medications, the checkups, the doctor consultation, like you go for a doctor consultation, it's 1,500 rupees for a consult or something. It's like crazy.
Right. Especially in the private hospitals these days.
Private hospitals. Good for the doctors. Okay, that's good, but maybe not that great for the for the patient.
So prevention is, it's an age-old adage, right? Prevention is better than cure.
Right.
It's a very, important part, because here's the thing. As a doctor, I should, wouldn't, say, people like, come to us, that's not the thing, So, better than that, right? People, they try to save up their money and, not take a gym membership. Or they say, this burger is cheaper than, buying whole foods and then, cooking it. And just buy the burger instead because it's cheaper and faster, right? You do that because you're trying to save money in the short span. And over time you develop the disease and you have to keep running to the hospital. You have to keep buying medications. And that over time, that is definitely more, detrimental to your expenses,
And the other thing that I see is that a lot of people, as you said, hustle culture, they work a lot and they end up like they have a lot of stress, which is also probably not good.
Sleep is,
the absence of sleep, which is not good.
Yeah.
And then they're like, why should I go buy something great or healthy? Why should I have healthy food or something? Let me have this burger, it's cheaper.
Yeah.
So stress, lack of sleep.
Fast food, it's quicker to just bite and eat it, right?
Right. And then they're like, I am going to get a fat paycheck. They're already getting like a fat paycheck because they want to maybe they're not getting a fat paycheck, but they aspire to get one later on, and then they probably also get it. Let us say, right. But then what happens is they have like deadly disease. They end up having some sort of a chronic disease by the time they end up getting the fat paycheck, and then retire. And what do they do with that money? I feel is that they will use that money to treat the chronic disease that they've actually developed. Right. So all the hard work that you've actually put in, right, making all that money is in treating the chronic disease later on. Right. But I think if you don't do that and make some small lifestyle changes, I guess 20 minutes to 30 minutes of exercise. Okay. That's it. 20 to 30 minutes of exercise.
Simply, a simple exercise such as brisk walking. That is recommended in hypertension patients. Simple, 30 minutes of brisk walking, not even jogging. Brisk, as simple as that, you can't you do it? You have 24 hours in a day.
Exactly.
Just half an hour of, brisk walking. It can change a lot,
That is wonderful, because then what will happen is that this person doesn't have to, in old age, when that person, whatever age is to a certain extent, maybe a complex disease, we put a number.
Even in 40s,
Even in 40s, right? This person can live a far better life. He or she can take the vacation.
Not just longer, a better quality of life.
Better quality of life, right? So it's like this, right? They say that when you're young, you have time, but you don't, and energy, but you don't have money. And then later on, you have energy, but you don't have time, and you don't have money. And then after that, you'll have time and money because you made it.
You won't have energy.
But you won't have energy. But this thing can probably, so that time, later on when you kind of like retire, when you have time and money, and if you follow this sort of a proper fantastic lifestyle, you have energy, and then you can live a beautiful life, I guess.
Definitely.
That extra 10 years or 15 years where people in old age and they end up having like a really bad lifestyle, end up having very poor quality of life. I think that can be really reversed, or that can be avoided in some sense.
You've been saying about the work culture, and a lot of software developers and software engineers, they have this hustle culture and all. But it's no less in doctors, those heavy like 36-hour shifts, 2-day shifts.
It's worse in doctors.
Yeah. So as I was saying, there was a cardiothoracic surgeon who died in his early 40s. Because he used to continuously work. He got rich, but dying at the age of 40, due to a heart problem. He was a cardiothoracic surgeon.
It's a moral problem in the sense that if it's a software engineer, like I come from the IT background and I'm an ex-software engineer doing healthcare right now as a full-time thing because this is my passion. Software is fine to a certain extent in that people give it a lot of importance, but if I write a piece of code and it doesn't work, it doesn't work, I'll fix it tomorrow. Right? But for a doctor, it's like if I get a patient who's about to, especially if you're a surgeon, which you're going to be very soon, if I don't operate on that patient is going to not probably survive. Right? So it's a morally gray area, because at the end of the day, surgeons are there for, that's why I respect surgeons to such a great extent. Okay, that yes, their health might in the long run be depleted, but it's a very important thing. So that's another aspect. But anyways, preventive healthcare is always better, as we were talking about. and a little bit of exercise, specifically resistance training also.
Training, yeah, both resistance training and what do you call cardio, yeah,
cardiovascular, right? Okay, can go a long way in preventing these problems, right? And what about protein? Any requirements for protein with regards to this, or I think it's mostly the exercise that matters first.
Yeah, it's exercise that matters. Protein, usually people say 1 gram per pound body weight, or usually actually you don't even require that much. 1 gram per pound body weight is like, for men, if usually we are 170 180 pounds, you don't need 180 grams protein. All right, 120 grams protein is around more than enough. Yeah.
The latest research actually says it's something like 0.6 grams or 0.8 grams or something like that per kg. Per kg, or I think per kg.
Per kg.
Per kg of body weight. It's pretty like an 80 kg person can have like 120 to 130 grams of protein.
Yeah. Those high protein, the cutoff values, you say like per pound, those are actually, it's more suggested in children, the babies. They need, to grow, the rapid growth, right?
Rapid growth.
For them, protein is required. For, a person who's building muscle, right? You do, proper resistance training and, an adequate amount of protein.
An adequate amount of protein can be very useful for having a healthy life. Yeah. That's something which... So we will do a deep dive session on protein, on exercise next time. But this is mostly about metabolic syndrome and about how exercise and nutrition can kind of reduce insulin resistance and lead to insulin sensitivity. And about insulin sensitivity, which we were talking about as the seed, right? Is there anything that actually causes insulin sensitivity? That is another thing that I just got. Like, is there a cause for the cause? Because there is a cause and there's the effect of the cause. But the cause itself could be an effect of an even more, I would say, deeper cause. So what is that?
So usually, when we divide, risks of, getting that disease, we divide it into modifiable and non-modifiable. Modifiable are such as diet, lifestyle, alcohol, smoking, etc. The non-modifiable part is genetics.
Right.
Yeah. So your first degree relative, such as your father, your mother, or your sister has diabetes, you're more prone to, getting diabetes too. Right. That is there. And other than that, there's obviously autoimmune diseases.
Autoimmunity, right.
Mainly, a disease called as SLE and, rheumatoid arthritis. Those two, there's a more risk of getting diabetes in those diseases too.
So, autoimmune diseases can also be a cause for diabetes and insulin resistance. Okay, so essentially, autoimmunity runs deeper than even insulin resistance. Is what you're saying. Okay, what is autoimmune diseases, if I may ask, for a layman from just one sentence perspective?
So what happens in autoimmune diseases is that you have an immune system in your body. Its main purpose is to protect your body from the outside, anything outside that's dangerous, bacteria, virus, etc. What happens in autoimmune diseases, in the name itself, instead of defending your body, the immune system and the cells in the immune system, they attack your own cells.
Okay.
And so in rheumatoid arthritis, as simple as the joints are getting affected, right? The immune system attacks the joints, the synovial fluid, as you say.
Okay.
It attacks that, and over time it deteriorates. That's basically an autoimmune disorder. Or there's many other diseases, gout and thyroiditis, etc.
Let me actually stop you right there. I think this is a very interesting discussion that we actually had, where we started off from insulin resistance and connected it to so many diseases, right, as a seed, and then right now we're digging deeper than even insulin resistance and going into something called autoimmune disorders, which, if I, in a layman perspective, were to put it, it's the body attacking itself. Right. So because it thinks its own body is a threat. So in the next episode, we are going to talk all about autoimmune disorders. Again, we would like to talk about it in the context of Indians, like how they suffer, from autoimmune disorders, what can be done about them, why do they come about, and we'll have a nice, fantastic discussion about autoimmune disorders from a very scientific and a very holistic perspective. Thank you for watching. Please subscribe for more content like this. Thank you very much, Annathi.